I doubt it. Okay, so if we can all hit the mute button, and I will give the intro here. Okay, so welcome to the live stream here of our Q&A for vaccination for 5 to 11-year-olds. We had promoted this on our Facebook feed and reached out to the public for questions. We do apologize for the technical difficulties that we had at the outset, but we had committed to following up and finishing this off and making sure that we got those questions answered. So that's what we're here to do today. I will moderate this chat and pass the questions out that we did receive from the public. My name is Dave McGuire, and I'm the lead for communications at the Northwest Territories Health and Social Services Authority. I've lived in Yellowknife for 33 of my 37 years. I have 2 young girls, ages 5 and almost 2. So I have a personal interest in today's topic, and I know that lots of people have interest in this topic. We received a lot of questions, and we're committed to answering them. And we know that with youth vaccination, there was going to be questions, and people want their questions answered. And we expected that. It took time to get through the adult vaccination program and reach the numbers and successes that we did, and we expect the same with our youth efforts here. And parents may have questions, and we do want to answer them, and we encourage everybody to get vaccinated, but we also encourage people, if they have questions, to reach out and be open to receiving information on it. So really, that's what we're here to do today. We have a number of physicians here today who work in the Northwest Territories, either full-time or part-time with youth and with our vaccination programs, and I'll introduce them. I just want a couple quick housekeeping items here. The format of today's event included receiving questions in advance so that we could be most efficient and eliminate duplicates and ensure that we knew what themes were in areas we'd focus on. We also have taken some of the questions out of the comment streams that we received in the promotions of the event, which we'll get to if we can within the hour. And I'll work through the questions, as many questions as we can. And the goal is to really approach this in an open, conversational way that allows each participant to add to the discussion. So I may bounce around a little bit, and I'll pass it back and forth to the different individuals we have here today. So with that, I'll introduce our speakers. And I will note that Dr. Candola had to send regrets, and in her place we have Dr. Andy Delli-Pizzi, who I'll introduce first here. Dr. Delli-Pizzi is a public health and preventative medicine specialist and the Deputy Chief Public Health Officer in the Northwest Territories. He completed his family medicine residency at the University of Manitoba and practiced as a family physician in Manitoba between 1999 and 2015. During that time, he worked for 7 years in a multidisciplinary community health center practice and also provided family physician coverage in rural and northern settings. He has worked as a hospital and inpatient physician and spent 10 years at the University of Manitoba Department of Continuing Professional Development. In 2018, he completed a public health and preventative medicine residency at the University of Calgary and also holds a Master's of Science in Public Health from the London School of Hygiene and Tropical Medicine, which is world-renowned for its research, postgraduate studies, and continuing education in the areas of public and global health. Welcome, Dr. Delli-Pizzi. Thank you for attending today. Next, we'll move on to Dr. Sam Wong. Dr. Sam Wong is a pediatrician who has worked in the Northwest Territories for over 20 years. I believe I have seen Dr. Wong with my own children, so that's great. Thanks. Nice to see you again, Sam. He works part-time in Yellowknife doing general pediatrics and travel clinics for a variety of communities in the Northwest Territories and Nunavut. He's also a part-time hospital pediatrician at the Stollery Children's Hospital in Edmonton, where he is working regularly now, and is a clinical professor of pediatrics at the University of Alberta. As part of his work at the Stollery Children's Hospital, Dr. Wong has personally taken care of children who have suffered from COVID-19 and developed some of the rare but serious complications linked to the disease caused by the virus. Dr. Wong is an active member of the Canadian Pediatric Society and is on the board of directors. He previously served as president of the Canadian Pediatric Society and as a past chair of the First Nations, Inuit, and Métis Health Committee. In Alberta, he is an executive member of the Alberta Medical Association representing pediatrics. Welcome, Dr. Wong. Thank you for being here with us today. And last but not least, I will move along and introduce Dr. AnneMarie Pegg, our Territorial Medical Director, who has steadfastly led our physician community through our pandemic response in the NWT, and who has also been a regular spokesperson for our efforts within the health system over the past 2 years. Dr. Pegg first came north as a community health nurse in Fort Simpson in the late 90s before returning to medical school. Since completing her medical training, Dr. Pegg has regularly provided services as a contract locum physician in the NWT. While maintaining a practice in the NWT, Dr. Pegg has also held progressively senior roles with Médecins Sans Frontières, that's Doctors Without Borders, including Hospital Medical Director, Mission Medical Coordinator, Head of the Mission, and most recently, Clinical Lead for Epidemic Response and Vaccination at the Paris Operations Center. So we have our doctors here today, and we're going to work through our questions. I know that a lot of people want to hear directly from people who are experts in this area, and we have a number of them here today. So I'm going to back off on the speaking and pass it along to the doctors, and we'll start with some of the simple questions we received here. So the first question that we received from the public was, what are the main side effects of the vaccine related to the 5 to 11-year-olds? And I'll pass this one over to Dr. Pegg for the first go.
Thanks, David. The side effects for the COVID vaccine for children aged 5 to 11 are really similar to the side effects for the vaccine for older children and adolescents and for adults. There aren't specific side effects necessarily related to the pediatric vaccine. Kids afterwards can have a sore arm, can have some redness at the site where the vaccine was given. Sometimes they can get a fever, some fatigue, some flu-like symptoms, and that can be treated with ibuprofen, which is Advil or Motrin, or acetaminophen, which is Tylenol. Lots of rest and reassurance that these kids have done their part to protect themselves from COVID.
Okay, great. So that one was fairly simple. We had a theme of questions about us pushing this vaccine, and a lot of questions about side effects, specifically long-term side effects. So I'll ask some of the specific questions. The COVID-19 vaccine is brand new, and children don't have a high risk of serious infection. It was the question. It was kind of the framing part. And why should a child receive the COVID vaccine in light of, the concept that perhaps they're not as at risk for more severe outcomes of COVID-19? So, Dr. Delli-Pizzi or Dr. Wong, would you like to take this one?
David, I can start, and then Dr. Wong can add. Does that sound okay? Yeah, and I think it's a really important question, David. And so, it's true that the mRNA vaccines are newly licensed as part of the COVID response, but vaccines are not new, and vaccines have been such an important part of keeping people healthy for many decades now. And, the World Health Organization thinks that vaccines prevent probably about 5 million deaths every year in all age groups, including children or older adults as well. So the mRNA vaccines, we've changed the way vaccines have been developed over the decades, and mRNA vaccines have been in development for well over a couple decades. So the technology is not new, and vaccines are not new. And now we've given billions of doses of mRNA vaccines, globally. And in terms of this age group, the United States has given well over 6 million doses of the mRNA vaccines to children in 5 to 11 age group. So in terms of why should children receive the COVID vaccine, it is true they're not as at high risk for severe outcomes as adults, especially older adults. But we do know there can be severe outcomes in children. So, for instance, children can be hospitalized. Children can be admitted to the intensive care unit. There can be complications like multi-system inflammatory syndrome, or MIS-C in children. And those can be severe outcomes. We have experience in the under 12 age group. Canada has lost 11 children in this group. So although deaths are not common, they can occur. And so we believe that it's so important to immunize children to prevent these severe outcomes. And that's the most important reason. The other reasons are that it can keep children doing the things that they like to do or they need to do, and that includes going to school or participating in other social activities. So it protects children's well-being as well. And we also know that because older adults are at such severe risk for severe outcomes from COVID, that if children are part of those transmission chains that can end in severe outcomes, it can protect others, especially in their family. For instance, in the United States, we know that the U.S. CDC is estimating that about 150,000 children have lost a caregiver or lost a grandparent, like a parent or a caregiving grandparent. So we think there are many important reasons for children in this age group to be vaccinated.
And I'll follow up with that, in that I've seen kids who've had serious complications of COVID, including MIS-C. I've done 2 weeks of hospital pediatrics in Edmonton in the summertime, and another 3 weeks now in December here at the Stollery Children's Hospital. In that period of time, in 5 weeks, I've seen myself 2 cases of MIS-C patients who ended up going to PICU and ended up needing PICU support. And it's one thing to be in Edmonton and requiring PICU support. It's another thing to be in the territories where your closest PICU is a 3-hour flight away by turboprop plane. So it's not as simple to take care of patients who are seriously ill in territories. And if you can prevent it by taking the vaccine, it seems to be the most appropriate thing. And even though it's true that the majority of kids don't have serious complications of COVID, it doesn't mean that kids can't get seriously ill with it, including MIS-C. And as of the week of December 16th, the American Academy of Pediatrics reported over 30 pediatric deaths in that 1 week of COVID in only 46 states that reported the deaths by age. So seriously, probably undercounted the number of pediatric deaths secondary to COVID. So to say that it's a relatively benign disease, I think is underselling the potential side effects of COVID. And I think when you look at the risk-benefit factors of COVID vaccines, I think it really weighs out on the benefit side of the vaccine compared to the risks of COVID.
Right. So I think a big piece that people struggle with is the idea of balancing risks of vaccination versus, the outcomes of COVID. The other thing that comes up a lot of the time, and what I'm hearing here is like the vaccine is safe, and we know that it's pretty effective. It's good. It's effective. It prevents people from getting really ill, and ill children are, something we all want to avoid for sure. And that the unique challenges of the North make it even more, more important to have that protection because of, the limitations that we do operate under here. One of the other themes that comes up is, the long-term effects of COVID-19 vaccinations. And I think this is a question that people, a lot of people ask it, and we had some feedback on this one. And I think people struggle with it because what's the definition of long-term, and the fact that we're kind of still in an early state here. So what would be the best thing to address the concerns of people who are worried about not the effects today, not the effects this month, but long-term effects in the future, right? So I'm wondering, Dr. Delli-Pizzi, do you want to take a kind of a shot at that one for long-term vaccine effect, not only effectiveness, but the potential for long-term side effects of vaccination?
Yeah, thanks, David. Yeah, so the most important thing is that the vaccine triggers a very important immune response, that is a memory to protect children from the SARS-CoV-2 virus the next time they see the virus for real. So that mRNA vaccine, we know that our body's immune system does eventually get rid of it, and it probably gets rid of it within a period of days. So it's out of a child's body because our body immune system naturally deals with that mRNA vaccine. So in terms of monitoring for adverse effects from vaccines, the clinical trials that are done are following children for about 2 years after the clinical trial. And we've had long-standing systems in place to monitor for adverse effects of vaccines in Canada. So there's a strong reporting system in Northwest Territories and in all province and territories where families, children, healthcare providers can report any adverse event following immunization. And so this might be something that is or may, we're not certain if it's related to the vaccine or not, but it gets sent for review. And then we follow certain criteria and report that to the Public Health Agency of Canada. And in fact, they report it to the World Health Organization. So this is all gathered globally, nationally, and internationally, and then monitored for signals of any adverse outcome. So this system does work. Like, it is important to talk about that the viral vector vaccines, we did detect a signal of some rare complications, very, very rare, but the monitoring system was effective in picking it up. And so now we can give people proper advice, and they can have discussions about the risks and benefits of vaccines.
All right. And Dr. Pegg, do you have anything to add to that?
Yeah, I think I'd just like to add in, because some of the conversations I've had with parents mostly is that when you're talking about your child, 2 years doesn't really sound like that long. So the vaccine trials have been going on with this vaccine, but people are still a bit nervous when they hear 2 years. It doesn't sound necessarily like it's long enough. And Dr. Delli-Pizzi mentioned earlier, but these vaccines have been under development for decades. For over 40 years, actually, the mRNA vaccine platform has been under development. And during that time, there's been a huge amount of research on the impact of that vaccine on human cells. It starts out very small, microscopic, petri dish, this type of examination, and then moves on to living cells and moves on to other levels of clinical trial. So we do have a fair amount of data on mRNA vaccines in general, although not the COVID vaccine specifically, but on this vaccine platform and how that interacts with our cells. That's been going on for a really long time. And so far, there hasn't been any safety signal that's been reported in those decades of research. So yes, it's a new vaccine in terms of a new vaccine for a new disease, but the amount of information that we have about mRNA vaccines in general is actually much longer than the COVID vaccine has been around for.
Great. And I think this is kind of a natural follow-up question, and it came across in some of the themes, is we're talking vaccine safety long-term. What about COVID safety long-term for people who do get COVID and maybe do get a more severe case of COVID? Dr. Wong, do you have anything to say about that, specifically, in children who do end up kind of sick and facing COVID? And there's two things. There's vaccine long-term and there's COVID long-term. And from what I'm hearing from Dr. Pegg is we have a lot of evidence to say that the vaccines, mRNA vaccines specifically, have a lot of safety, and that we also have really good systems to track that, so that if there was something that was there, we would find it and we would act on it. And we have acted on it already in shifting kind of the vaccine, how we do the administration of the vaccine in terms of what doses we offer to people and things like that. But anything to say about COVID and kids and the long-term effects of that, maybe?
Yeah, so far, I mean, COVID's almost 2 years old now in Canada. And so we don't know much about the long-term effects of COVID. We do see in adults long COVID, and it is estimated about 10% of patients who have COVID end up having long COVID, which means they have symptoms lasting longer than 6 months. And so we do see that in adults. The data in kids is still pretty preliminary, and I haven't seen much in the way of the long-term side effects of COVID yet. And we haven't seen much in the way of long COVID per se in kids. So we've been lucky that way. But once again, the numbers are so much higher in adults that we're going to see that. And the numbers are not as high as in kids. However, with the states and the way they've managed COVID, I think we're going to start seeing those numbers. And I think the data will be coming out in the next 6 months to a year, where there will be long-term COVID. But right now I can't speak, and I would only be able to speculate on whether there is long-term effects of COVID. We do know that, COVID can put you at a higher risk of myocarditis and pericarditis than the vaccine. And certainly that we're monitoring as well. Sorry, hold on a second. An old style phone here that rings quite loudly here. But I do think that looking at the data so far, we don't have that data yet, and that's something that will come out.
And you did touch on something there, and I know I've heard Dr. Pegg talk about this, so let's fold it in here. We do get people, and there was questions in here about the risks of heart issues, pericarditis, myocarditis from the vaccine, and you mentioned it also, Dr. Wong. There's a risk of that with COVID, and when we're talking about balancing risks, like Dr. Pegg, do you have anything to say about balancing the risk of that rare outcome versus the outcome within, getting COVID and the risk of pericarditis and myocarditis and those types of those types of impacts from the disease?
Was that to me or to Dr. Pegg?
Either or, whoever wants to take it. I know I've heard Dr. Pegg talk about it, but if you can go ahead if you want, Sam.
Sure, yeah, and it's interesting. I had a conversation with my pediatric cardiology colleagues yesterday about this particular topic, and the risk of there is a risk in adolescents and young adults for myocarditis and pericarditis from the vaccine itself. We have not seen that in the 2 to 5 to 11-year-old. I did talk to my colleagues, and they have a web server where they kind of monitor cardiac problems. And before the myocarditis and pericarditis issue came up with the vaccine, there was some talk on the web server about 3 weeks prior to it being made public. And so far there has been no talks on the server about pericarditis or myocarditis in kids in the States, where they're doing it over a 3-week span. So they're getting the second dose 3 weeks after the first dose. It is well known that if you go longer, like we are doing in Canada with the second dose, that you reduce the risk of myocarditis and pericarditis. And based on the preliminary numbers that we've had with the millions of kids who've been vaccinated with the second dose in the States, it seems less likely to see this side effect. And I don't think it's going to be an issue in the 5 to 11-year-old range. I could be wrong. However, thus far, from what we've seen, we would have expected something to spike on that server, and the cardiologists have said there hasn't been anything yet. And we're well into December now, and they started vaccinating at the end of October, beginning of November. So it's been quite a few weeks and quite a few millions of second doses given with no real spike above the baseline when it comes to myocarditis or pericarditis in this age group. So I would be, I would think that it's going to be a less of an issue because of the lower dose, as well as the fact that we're going longer between intervals for second dosing in Canada.
Great. And maybe Dr. Pegg, there is a risk of those outcomes from COVID, right? Like getting myocarditis, pericarditis, like those things that people are concerned about the vaccine being a risk. COVID also presents a fairly serious risk of those outcomes also.
Yeah, certainly there are cases of myocarditis and pericarditis reported in individuals, including children, as a consequence of their COVID infection. And as well, we've spoken about multisystem inflammatory syndrome in children, which can also result in myocarditis or pericarditis, and often a more serious myocarditis or pericarditis than we see associated with the vaccine. The cases associated with the vaccine to date have generally been quite mild and have resolved for the most part with treatment and medication. And that's unfortunately not been the case for some of the children that have acquired myocarditis or pericarditis through a natural infection or through a complication after an infection.
And I would like to add, David, that when I was talking to the cardiologist yesterday, and these are the same cardiologists that provide pediatric cardiology service to Yellowknife in the Northwest Territories, that their risk, they commented that the risk of myocarditis and pericarditis with natural infection is so much higher than if you were to take it with the vaccine. So they are highly suggestive of they're recommending the vaccine to all their kids, including the kids who have congestive heart failure. Not congestive heart failure, congestive heart disease that they see. So unless they've had previous myocarditis, there's no indication against them to not get the vaccination. They should be getting the vaccination. And if they did have myocarditis before and they've recovered, they can have a discussion with their cardiologist about it, but they still recommend that they they receive their vaccination.
Great, thanks. Very interesting. I think there's an opportunity here. There's a couple of kind of procedural questions that are along this theme that we can do a couple quick hits and get through to cover some ground, I think. So there was one question here that says, does the vaccine affect children with heart issues such as a murmur? Is it safe for children with a heart murmur to get the vaccination?
And I think I responded to that in my previous comments, that the cardiologists are recommending the vaccine for all their congenital heart disease patients. So those kids with murmurs or kids with ASDs or VSDs, that have congenital heart disease of some sort, they're still recommending it for those patients. And they think it's safe.
Great. I just wanted to get the actual question as asked on there so we could get that individual a little bit of comfort in making their decision. So that's great. We've addressed this one. I'm just kind of working through what I have here. One of the questions was how many days after getting, or I guess recovering from COVID, can a child get the vaccination? Dr. Delli-Pizzi, do you want to speak to that? Do you know what our guidelines say?
Yeah, so the National Advisory Committee on Immunizations has commented on this. So basically they feel, and as soon as a child recovers from COVID-19, that they can receive the vaccine. And if the child had a severe course of COVID-19, including MIS-C, then we should wait until that recovery, or sometimes 90 days. So if somebody's had a severe course of COVID, then they should review. But otherwise, if it's been a mild course, children can receive the vaccine as soon as they recover, yeah.
Great. And there was another question in here for Dr. Pegg, treating post-vaccine pain. So we do have a good tip sheet on how to speak with your kids about vaccination. When I went with my daughter, I asked her if she wanted me to go first, and she's 5, and she was very brave. She said, "No, I'm going first, Dad." And I thought that was really brave of her to step up and tell me she's going to do it, because I got my booster at the same time, and I was very proud of her. So along with that, so treating post-vaccine pain, is there any kind of tips for those types of things for parents, and maybe, if they have kind of mild side effects afterwards, Dr. Pegg?
Yeah, I think, the first line, of defense, or the line of treatment, is some over-the-counter pain medication that you would use in cases where your child has other types of pain or fever. So ibuprofen, which is Motrin or Advil, or acetaminophen, which is Tylenol. That can be effective in alleviating the pain or some of the fever or muscle aches and other symptoms that go along with the period after a vaccine. I think the other thing to remind kids is, the older ones especially can hear that the side effects after a vaccine means that their immune system is working, and it's making antibodies, it's making fighters to protect them against COVID. And so even though they feel kind of crummy and they're going to maybe take some medicine to try and feel better, those symptoms that they're getting are signs that their body is working and that their immune system is working and that they're getting protected from COVID, and that it's not going to last for very long. And then they're going to be protected, and they're making themselves safer. So I think that can help to explaining it in a way that puts those symptoms into context. Okay, great.
While we're on it, Dr. Pegg, and I can help with this also, there's kind of 2 procedural questions for, how do people line up their bookings for their dose, kind of first or second, and the process would be different in Yellowknife and in other communities. And then second to that, what about proof of vaccine for this group, which is now kind of becoming a requirement for adults across the nation, but are we providing it? And if not, when might we?
So the first question, you're right, it does depend on where you are, how you book either a first dose or a second dose. For communities outside of Yellowknife, the easiest way is to contact the health center because they have the schedule and the plan for how they're administering those first doses, and probably some clinics coming up as kids get to be due for their second dose. There'll be opportunities to get first doses at the same time as others are getting their second dose, but calling the health center is the best way to get the up-to-date information. or the public health department for those communities that have public health departments. In Yellowknife, we have an online booking system, so nthssa.ca, and then I don't know what the whole website is, but if you Google NTHSSA COVID vaccine, it will take you right there. And booking slots open up between 2 and 4 weeks in advance. And the reason that they're not further in advance is because we do gauge the demand for appointments in order to make sure that we have adequate staff and space and supply to respond to the number of bookings. So keep an eye out as second doses are coming up so people can book. And yeah, 2 to 4 weeks is when you can get in for those appointments. For the proof of vaccination credential, we'll be rolling that out for 5 to 11-year-olds in the new year. Just to reassure people, the proof of vaccination program in the territory, so businesses that ask for that barcode or proof of vaccination, that only applies to children over the age of 12. So kids who are 5 to 11 actually don't fall into that. So they wouldn't need to present that to a business here in the Northwest Territories. If people are looking for the proof of vaccine to travel, so on a flight or take a train, the proof of vaccine only applies right now for children older than 12 years and 4 months, which is likely related to the time that they rolled that out. So again, the younger kids would not be required to provide that proof of vaccine document. And if someone's moving and they want to have the proof of vaccine to take with them to the new place that they're going to live, either another territory or another province, they can request a copy of their medical record, either through the health center or online for those in Yellowknife, and the vaccine credential and the vaccine record would be included in that medical record. But again, just to let people know that is coming in the new year, that there will be a PVC for younger children. Stay tuned.
Great. Okay, a couple quick ones here. Are there antibiotics in the vaccine? Many children have drug allergies. So, Dr. Delli-Pizzi, anything to say about that?
So there aren't any antibiotics in the vaccine. The vaccine constituents of really both the Pfizer and the Moderna vaccine are the mRNA itself, and then these lipids, which actually protect the mRNA and get the mRNA to go into our cell, and then just things to stabilize the pH and things like that. So there are no antibiotics. And the Allergists Association, I've forgotten the name of the Canadian Allergist Association, but they've made a really clear statement that Dr. Pegg actually disseminated to all the practitioners here in Northwest Territories, that routine allergies, like allergies to things like antibiotics, are not a reason to not receive the COVID vaccines. And if somebody did have an allergic reaction, then we would review it. Typically, the healthcare providers would review it with the allergist, but there are no antibiotics in the COVID vaccines.
Okay, great. And I think for anybody, what we do say to the public, if you have allergies or concerns, again, it's about talking to your healthcare provider and just have that conversation, and they'll have the latest guidance and be able to walk you through that, figure out what may be appropriate for your vaccination or your child's, and as well as talk through any concerns that you have. That's really important. Getting information from the reliable source, a doctor you trust, somebody that's seen your kid before, your primary care provider, whoever you have access to that you're able to speak with. Okay, so there's some questions in here along the theme, and I kind of want to, there was a number of them, and I want to kind of elucidate what they were trying to get across in the best way I can, and then talk about this in two themes. So let me read one of the questions, and then I'll expand upon it a bit. So it says there's no available data from the CPHO or the NTHSA that indicates the severity of COVID in children, and some people have personally witnessed a number of children who've had COVID-19. It's been very mild illness, no symptoms, recovered in a few days. So there's some of that, and then there's there's the general theme that we're rolling out a vaccine that is for a group of people, and we touched on this earlier, that really are so unlikely by the numbers people say to be harmed by COVID. So Andy, I think if you could tell me a little bit about how much data we have on COVID and vaccines. I've heard stats that we've never had a health initiative before with so much data, just because of the time that we're in, and it's a worldwide problem, and the data we're carrying. So, if you could tell me a little bit about how we're tracking the data and how we're keeping the science safe, those things. So you talked about that in the past and some of our kind of all staff things. And then Sam, if you could follow that with maybe a perspective of, I think there's a lot of people who think, probably not going to be me, but if you could tell us a little bit about what it looks like when a kid does end up in hospital who has COVID and is really sick. Because I personally, as a father, could put myself in that situation. And like, if you think through that and you have a vaccine that could potentially prevent that, I think that's kind of the core of what we're trying to get to today. So let's go with the data piece, Andy. And if you could tell us a little bit about how much information we have and how we're analyzing it, and the science that you're looking at regularly to ensure that the decisions we're making are the right ones. And then, Sam, if you could tell us what it's like on the ground and how these vaccines are kind of helping us change the hospital and avoid those situations.
Yeah. So I'll start with the data part. And, this idea of surveillance is a really fundamental part of public health practice. And surveillance means this kind of gathering of data routinely and then analyzing it and interpreting it and then sending it back out to everybody who needs to know. So this kind of cycle of surveillance, and it's not surveillance, we're watching you, it's public health surveillance of health outcomes and health data. So we know we've in Northwest Territories and all across Canada, we're asking healthcare providers to report things to us. So we're always asking for reporting on anyone who's been diagnosed with COVID, anyone who's been hospitalized. We monitor for severe outcomes. We work very closely with the medical examiners to, make sure that we're counting deaths properly, because that's been an important number to report as well. So we're always gathering the data and analyzing it. We can tell you in Canada, there have been over 225,000. I have some of the numbers here. Over 225,000 Canadian children aged 0, up till age 11 that have been diagnosed with COVID since the start of the pandemic. So that's roughly about 1 in 10 diagnosis. And since the fall of 2021, we've seen the age group of 5 to 11 become the highest incidence group. They're getting infections at a higher rate than any other age group. And that might be because other age groups are covered by vaccines, and 5 to 11-year-olds are gathered in congregate settings in schools. So that might be part of it. But certainly since the fall of 2021, we've seen the 5 to 11 age group have the highest risk of infection itself. We talked about Miss C. There's very good reporting on Miss C. We know that in both the U.S. and in Canada, it's about 1 in 2,500 or 1 in 3,000 people under age 19 will develop Miss C, because that's reportable as well to us and then reportable to the Public Health Agency of Canada. So it's a really important system to try to describe the impact of COVID in Canada in NWT. And that we use that data to help. In terms of David, does that answer your question, or was there anything that I missed?
Yeah, I think the key piece for me, being a layperson who's not a physician or a scientist, understanding and knowing the scope and scale of an effort going into monitoring both the safety and the outcomes of the vaccine and how it's impacting COVID. It gives me some comfort knowing that we have guys like Andy doing that work who understand it and are informing our decisions. So I guess that's kind of what I was trying to get at. And that's really helpful to understand that there is this broad global effort of data and analysis and constantly relooking at the decisions that we've made to look back and make sure that we're making the right decisions forward based on evidence, I think is the key. So we have that. And then we have a lot of people saying that there's not a lot of harm that can be done, and we don't know the longer term pieces. We've kind of gone over the fact that we have these tracking mechanisms to ensure that any kind of incidents of vaccine harm are taken, documented, analyzed, reported, so that it's clear, it's transparent, it's the government of Canada, it's the World Health Organization, everybody's getting this information. So it's there to be found. If you're looking for vaccine harm information, it's there, it's documented. There's still a sense that COVID doesn't really harm kids, but I heard Sam say earlier he's working at a children's hospital where kids are getting COVID. So if we could maybe just a bit of a perspective on that, obviously being respectful of the patients themselves, as we always are, privacy and the rest of it, but just a a physician's viewpoint from working with kids with COVID and what that means. And I know when you're an adult with COVID, you know, it's a different experience. The hospital stays different. There's a lot more PPE. You know, there's less ability to have visitors and those kinds of comforts. So what does it look like for the people that do end up in that, you know, bucket of people who are having a child who has COVID and it is serious illness?
Yeah, thanks, David. It's interesting because it's a different perspective working in Edmonton at the Stollery Children's Hospital. Because you've seen way more patients and because there's way more COVID down here, you're more likely to see patients with COVID. The few patients I've had with Ms. C have been quite sick. They usually have a fever, they feel crappy, they're tired, they're cranky and irritable, they're not happy, parents are not happy, they're not sleeping, parents are not sleeping, and then eventually their blood pressure tanks and they end up needing ICU help. So that's one aspect of it. And it's not, I mean, nobody wants to go to ICU. One shouldn't see their child in ICU either. And that's something that's quite serious. For those kids who have, you know, regular COVID and don't have the MIS-C, I've had a couple of admissions where they've been not super sick, but they're tired and they don't eat and drink. And then because they're not eating and drinking, they get dehydrated. They end up having an IV and they have to come into hospital for a few days until they've recovered. And so that's a relatively mild admission. And then there's the wide range of those kids who never make it into hospital. And there's a large number of those kids who don't make it into hospital for sure. But it's a numbers game. And I think if you have a large enough numbers of COVID in this population, you're going to see the side effects. You're going to see the serious adverse effects of COVID. And you can certainly see it in the States where they have large numbers of kids who have had COVID. They have the numbers of MIS-C is incredible. And the fact that there's so many kids are dying of COVID is just, to me, mind-boggling when it's totally preventable. If you have the vaccine, why would you not get the vaccine and prevent your kid from ending up in ICU, even if it's a small numbers? I mean, you know, you look at Northwest Territories, we don't have a large population. We don't have a large population of kids. And so you could play the numbers game. You can roll the dice, and it's a gamble. But being the conservative person that I am, why would I roll the dice on my kid's life or health? To me, that seems silly. I would want the best for my child, and I would want to protect my child as much as I can. And so the vaccine, from what we've seen so far, has been very effective and for preventing serious illness and death. So why not take it with very few side effects? And we haven't seen really much in the way of side effects in this age group so far. And I mean, I admit that it's still pretty early, but the signs are not there. We've been monitoring, and you can't find a vaccine that's been monitored as closely as this one has been done in the past. No other vaccine has been monitored as closely as this and has been followed not just by researchers, but by lay people, by the press and the media. So, you know, they would have jumped on anything by now. And so I actually think that I would, you know, I highly recommend the vaccine. And having seen the kids I see in the hospital, to me, it seems like a no-brainer.
And Dr. Wong and David, I could, you know, in terms of the vaccine effectiveness, the clinical trial in children, there were about 1,500 children who received the vaccine, and they were compared to children who didn't receive the vaccine. They were followed for a period of a few months, and the vaccine prevented 91% of COVID infections in the children that received the vaccine compared to those who didn't receive the vaccine. And so we know in adults that effectiveness to prevent infections does start to wane, and it looks like it starts to wane at around 5 or 6 months. So everybody's going to be watching that very closely. And then, you know, what we're seeing, monitoring the vaccine effectiveness. But there are many groups all across the globe that are monitoring for vaccine effectiveness by age group, by variant, and things like that. So I just want to add that we have good, strong evidence that the vaccine prevents infections. And, you know, we're going to get evidence in terms of how effective it is at preventing severe outcomes. Because they're a little bit more rare, they could, you know, we didn't see that in the trial of small children, of smallish numbers, 1,500, but we will be following that as the vaccines are implemented.
Yeah, so I'm glad you touched on that, Annie. There were some questions about vaccine effectiveness and the idea that, why get the vaccine if you can get COVID anyway? But I think those stats are pretty stark. 91% of people were prevented from a COVID infection. So yes, there's breakthrough infections and people do get COVID with the vaccine, but far less of them get COVID. And the ones who do are far better off when they do get COVID if they have a breakthrough infection. So I think that's really important information for people to, know that like it does reduce your chance of getting COVID, and it really reduces your chance of, ending up with a severe case of COVID. So I have two more things here, and I'll kind of one to put to everybody and then one for Andy, because there was one person who's really had a specific question they really wanted to ask, and I think it might be for Andy. And then I'd like to close on, and it might take a second to think about this before you provide a response. And Sam touched on it there, but there's this idea that, like as a physician, you have like a duty and an oath to, I think they're speaking to the Hippocratic Oath to do no harm. And I don't know if physicians in Canada take that or not, or what we do regarding that, but you really do want to help, and you don't want to harm people. You want to make life better and more health. You want people to have more health and wellness in their lives. So I think I'd like to close out on your kind of personal, why would you encourage people to do this, knowing what you know, as a measure to, reduce harm by COVID, which we know is harming a lot of people. So I'd like to close on that. So I'll give you a second to think about that. But before then, I'd like to ask Andy this one question. It's kind of about the measures. And COVID's made all of our lives very difficult. It's demanded a lot of people. It's, obviously has mental health impacts and all these other things. We've been living in a very different way over the last 2 years, and it's been difficult. And I'll quickly plug it. The NTHC has mental health services. If you need to reach out, nthc.ca/mental-wellness. It's on our homepage too. Get on there and look at what's available to you. We have all kinds of support lines. We have community counseling programs, and it's important to reach out if you need those supports. But the question was to, can we provide kind of data or indications that the vaccination of a broader set of the population, the children, will start to move us towards a new normal, a better normal of reducing and eliminating COVID disease in the community, eliminating the continued disruptions of schools, getting rid of the masks, which have become just like a normal thing. They wear them all the time, the kids, like it's an essential item for them. And then, ending of the public health emergency and those types of things. Will this lead to that, I guess, is the question they're asking.
Yeah, so, this pandemic, it's really fair to say the pandemic has affected everyone, and everyone in different degrees, and some people in so many important ways, and it's really impacted well-being of the people who live in Northwest Territories and people who live in Canada and the global community. So we've always, the goals of the pandemic response have always been to reduce severe outcomes, to preserve well-being and prevent societal disruption. And so the vaccines can very clearly prevent severe outcomes. They can, by preventing infections in children, by preventing outbreaks in school, they can allow children to do the things that they need to do and do the things that they want to do. So keep children at home, keep children, in their homes, not in hospital, keep children in schools, and keep children doing the things that are so important to them. So the vaccines will help us respond in this pandemic and find this kind of path of least harm. When Dr. Wong mentioned, that prevention is so important for the North, if we say that an ounce of prevention is a pound of cure, well, in the North, an ounce of prevention is probably 10 pounds of cure, because for the reasons Dr. Wong mentioned. And so vaccines really are our pathway to the least harm from this pandemic and all those things. So in terms of masks, we've always had the response that we need multiple layers in this response, and vaccines are a part and masks are another part. So they're separate issues. We can't really say that once we hit vaccine coverage of this, we won't need masks. What will happen is once the risk comes down and we analyze the risk and we feel that masks aren't necessary for protection, then that'll be the time that we kind of ease up on the masking order and things like that. But we're going to be, Dr. Candola really is clear that we're going to be wearing masks at least through the winter, because we know that there's a threat of Omicron infections, the transmissibility, and so we'll look at masks again in the springtime. Yeah.
Okay, and so we have 5 minutes left. I'm not going to get the last word here because I think it's most important that you guys get the last word. I want to say thank you for your time today. I think this is really valuable. And throughout the pandemic, we've been working really hard to get good information out to residents. And I know not everybody, it's not easy for everybody to sit down with a doctor and have these discussions. And this is an hour of time that's, it's pretty in depth and there's a lot of questions asked. But I think it's really, really valuable getting that information out there. And, from my kind of role in helping the health system, this is huge. And in the new year, we do aim to kind of do some on the ground stuff to go talk to people who are, have concerns and want to speak to somebody who knows a lot about this topic so that they can make those decisions for their kids. But speaking to the residents that are watching this now, maybe one by one, and if Dr. Pegg comes back on, we'll get her at the end. But Andy, as a physician and as somebody knowing what this idea of going forward with youth vaccination, what would you say about why it's important and what would you recommend people do?
Yeah, I think it's so important for vaccinating children age 5 to 11 because the risk of severe outcomes is present. It's not high. It's not the same at risk as if an older person develops COVID, but it is present, exactly like Dr. Pegg and Dr. Wong have mentioned. And so, we know that we've taken such great strides in improvements in our health by reducing serious outcomes from communicable diseases over the last century. And we're starting to see those gains lost. In 2020, deaths from COVID were the third leading cause of deaths in Canada. So behind all cancers altogether and heart disease. And then it was COVID, And so these are preventable deaths. So the most important reason for children to get vaccinated is to prevent from severe outcomes. And then, it's also important that it will provide a layer of protection for their family members as well. Like we mentioned, in the United States, there's close to 150,000 children who have lost a parent or lost a caregiver grandparent, as per the US CDC. So those are by far the most important reasons. And then, just the promotion of well-being and keeping kids in school is just so important as well.
Great. So I'll go to Dr. Wong next. Same kind of question. Like if you're speaking with a parent and they're kind of working through this decision of vaccination, and you said earlier, preventing harm from kids. I think it's, harm to your kids, but harm to other kids too is important. And, that kind of brings me to the analogy of it takes a village to raise a kid, it takes a village to protect the kids in the village. So that's kind of my takeaway from some of the discussions today. But if you were speaking to, parents of the Northwest Territories who are making this decision about vaccination for that group, what advice would you have? And what do you have to say about, the questions that come, why would we do this if it could potentially do harm, as the line of questioning seems to be one of the themes we've heard?
Yeah, and I think as a parent, you always want to do best for your child. You want to protect your child. You want to make sure that they have the best health and the best resources. And I think the vaccine is one of those ways to help protect your child's health, to minimize any of the possible adverse effects you could get. Because the question is not if you're going to get COVID. The question is when you're going to get COVID, especially with the Omicron variant. And I think that, it's not going away. COVID is not going away. It's here to stay. And the best we can do is make it so that it's more like a simple cold and it doesn't cause any problems with hospitalizations and death and increased morbidity. And I think the best way to do that is by vaccinating everybody. And once we get down to the infants, when we get the vaccine and it's safe for 6 months and older, then I think that's where we want to be. And we want to vaccinate a large portion of our population so as to protect them and allow us to kind of move on from COVID, keeping in mind that it won't go away and we will eventually get it. We will all get it eventually. And the idea is when we get it, we just get mild symptoms because we've been vaccinated and not end up in hospital, not end up having MIS-C, not end up having, your child going into hospital because they can't eat or drink because of COVID. And that's really, I think, the important part of why this vaccination is important and why we do vaccinations in general. And I put a plug in for all vaccinations. They're very important in making our kids safe and providing good health for them, especially when their immune system is still developing.
Great. Okay. And so we'll close out with you, Dr. Pegg. I guess opportunity to kind of, anybody watching, what would be your advice on this to parents, especially the ones who are particularly concerned about, the vaccine doing harm and, maybe feeling like COVID maybe not an eventuality or a worry if their kids do catch it? I think you have to hit your mute button there, AnneMarie. We made it this far, but almost did the whole thing.
Okay. So I think that it's important to remember, and we recognize that parents who are choosing to vaccinate their kids are choosing to vaccinate their kids because they've decided that's the best way to keep them safe. And parents who are choosing to not vaccinate their kids also are doing it because they think that's the best way to keep their kids safe. All parents want to keep their kids safe. And what I would say to parents and caregivers who are struggling to make a decision, or even who have made a decision and they're really quite certain that vaccination of their kids is not for them, is that listening to me as a representative of the government may not be the most convincing way to change someone's mind or to introduce some new information. But I would encourage anybody who is very worried about vaccine or very concerned that the side effects or the long-term effects of the vaccine outweigh the risk of COVID to reach out to someone that you trust who shares a different opinion, who's opted to vaccinate their kids, who's vaccinated themselves, and talk to them about what made them decide and talk to them about the information that they accessed. Because we do know that once you start to look for information, unfortunately, the internet feeds us information that reinforces things that we've already looked for. And I get lots of information on my social media feed that says vaccine is great because that's the information that I look for. And people who are concerned about vaccination and are maybe, tempted to look at links and articles that may not be from very reliable sources, then often get preferentially provided with information that supports that misinformation. And it's really difficult to tell the difference. So I would just say, find someone in your social circle that has a different opinion from you and sit and talk to them about how they came to their decision. And then if there are questions, and you have a good relationship with your primary care provider or someone in the health community, to go run that by them, because I think there's lots of conversations that still need to happen. And everyone just wants to keep their kids as safe as they can.
Great. And those conversations, this is part of that. So I want to thank you for helping us meet our commitment to, advance this conversation. I give everybody an opportunity for a last word, but otherwise I think we can end here. And I think this is great. I think we got what we needed out of this for today, and there'll be more questions. My job to help answer them. Send them to us as you normally would through our website, through our social media feeds, and we will get back to you as soon as we can and help provide the best information as possible. So unless anybody has anything to add, I will cut it off there, end the stream, and say thank you all for your time today. Okay, great. Stay warm.